Hello, anatomy colleagues. This is Dr. Alsop, and in this video, we are going to be discussing many of the muscles of the pelvis. We have two learning objectives to work through, one focused on the piriformis muscle and one focused on the pelvic diaphragm. So make sure you return to these after viewing and try to answer these in your own words. So before we get into the major muscles of the pelvis, I do want to start with the piriformis muscle, which definitely is also in the pelvis. Its proximal attachment is going to be on the sacrum. So you will see it in the posterior most portion of the pelvic cavity region. But then it will traverse the greater sciatic foramen in order to distally attach on the greater trochanter of the femur. So a lot of its belly is actually located in the deep gluteal region as well. And because of this specific location, this muscle is often referred to as the key to the hip, as it helps to demarcate the location of a lot of the neurovasculature in the area. And because it crosses the hip joint, its major actions occur there. So that would include primarily lateral rotation of the hip joint, but also abduction as well. Moving more to the pelvic floor, which is composed or shaped like a funnel or kind of a sling shape pelvic diaphragm. And these muscles and their fascia will separate the pelvic cavity from the perineum, lying within the true pelvis. And these muscles will have openings or apertures that allow for viscera to traverse. So that can include the urethra, the vagina, as well as the rectum, the anal canal junction region. The pelvic diaphragm is composed of two muscles, the levator ani muscle and the ischio-coccygeus. I have ischio in parentheses because sometimes you actually just hear this muscle referred to as the coccygeus muscle. We will start with the levator ani muscle as this is the largest and most important component of the pelvic diaphragm. It consists of different parts that are named after their attachments. Some are visible on this image on the right, so like the iliococcygeus or the pubococcygeus. You're not responsible for these parts, these subdivision names, but I did want to make you aware that oftentimes these portions of the levator ani are called their own muscle. It is within the levator ani muscles that the openings for the viscera that we just discussed are going to be located. And this muscle is tonically contracted pretty constantly to support the pelvic viscera and will also play a role in terms of fecal as well as urinary continence. The ischio-coccygeus is the posterior portion of the pelvic diaphragm. It's considerably smaller, not nearly as visible, but it will have similar but supportive role to the levator ani. Again, the more important muscle in this region. The pelvic floor can be damaged, and one of the most common reasons for this is childbirth, but there can be other reasons as well. But childbirth, that can also damage, say, perineal structures and surrounding ligaments as well. So the most medial compartments or medial portions of these muscles can be damaged, those closest to the vaginal orifice, and they can affect the other structures in the region. So those are going to be the most commonly injured portions, and this can have lasting symptoms because stretching or tearing of these fibers may decrease support for the pelvic viscera. So, and that can include that really closely placed urethra, which could lead to urinary stress incontinence, typically characterized by like a dribbling of urine, which will increase during increased intra-abdominal pressure. And that can happen in things like coughing or sneezing or lifting. I do want to note that there are more muscles in the pelvis that are skeletal muscle, but we aren't going to be discussing in this section of the course. And these are the muscles of the perineum. Many of these are associated with erectile bodies and really should be discussed with the erectile bodies. So this will be discussed in more detail in the reproduction portion of the course. Practice question time. Which of the following muscles is not considered part of the pelvic diaphragm? What are you thinking? So you got to remember what's the pelvic diaphragm. So let's go through these answer choices. The ischio-coccygeus is located posterior. It is that posterior portion of the pelvic diaphragm, so this is not the correct answer. The levator ani is the biggest muscle of the pelvic diaphragm, the most important one, so this isn't correct either. So that leaves us with the piriformis muscle. Its belly is located within the pelvis, but it is not considered part of the pelvic diaphragm. So C, piriformis, is going to be the correct answer. Excellent. Thank you so much for your time and attention.